Hi, everyone. We wanted to welcome you to our newest webinar that we are excited to bring to you from MTF Biologics. I am 𝐅𝐚𝐿𝐼, the Executive Director of Children's Craniofacial Association, and I'm here with Lisa Miller, the Senior Product Manager at MTF. So thank you, Lisa, for being with us today.
Thank you, Erica, for having me.
Absolutely. We're so excited. This is something that I'm really excited to bring to our community because I met Lisa at ACPA and the group had a booth there. And I said, oh, this looks very interesting. Can you tell me more about it? And she did. And I was instantly like, you know what? I think the CCA, the craniofacial patients need to know about this option in reconstructive surgery. And so Lisa was generous enough to say, well, I can absolutely record a webinar with you. And this will be obviously, as you're watching it on demand on YouTube, but we'll also be sharing it with our community throughout Craniofacial Acceptance Month. So with that, Lisa, I know you have a few slides. I do want to let our listeners know there are a couple of surgical images. So just a heads up on that as she's going through the slides. But with that notice and with my sincere gratitude, I'll turn it over to you, Lisa.
Oh, thank you so much. So let me go ahead and share my screen. Yes, I'm excited to be here today to share with you some information about Extearna costal cartilage. So I did want to share and explain a little bit. So Extearna is the first and only costal cartilage allograft for complete ear reconstruction. And before I get into more about Extearna, I wanted to explain a little bit about allografts, as that may be a term that many of you are not familiar with. So allografts are any bone, ligament, cartilage, tendon, or section of skin, even placenta, that can be transplanted from one person to another. And it's also referred to as donated tissues. So just as you can donate blood, you can donate organs, you can also donate these different tissues, ligaments, cartilage, tendons, for other people to have surgery. And every year, there's more than 1 million allografts that are used in the U.S. Types of applications or people who need them are athletic people who need to have knee reconstruction, people who have back pain, cancer patients who need tumor surgery, people who have chronic wounds, and then, of course, individuals who require total ear reconstruction due to congenital conditions or trauma. These are some of our tissue recipients from our website. So, we have a whole range of people who tell their stories and share, how that tissue or that allograft has helped to enhance or save their life. So everyone from Taria Pitt, who was caught in a wildfire and she received skin for burns. We have Blake, who had some dermis or skin grafts to correct his cleft lip and cleft palate. We have this young lady who had breast surgery or reconstruction after cancer. And then we have Dylan, who had a bone graft because she had cancer in her bone. We have this young lady who had a costal cartilage graft in her nose because she needed her nose reconstruction after a vehicle accident. This gentleman who had an ulcer and needed a placental graft. So many different people that we have helped through the years with tissues. And in fact, MTF Biologics has been providing allografts for more than 35 years, more than 10 million allografts worldwide from 150,000 donors. We're very strict in the screening criteria. We always look for infectious diseases and certain disease processes to make sure that these allografts are safe. So we've never had an instance of viral disease transmission in all of our years. We have lots of publications saying that our tissue is safe and that it works. We have more than 90 published, more than 90 patents. And we know that every minute of every day, there's an MTF Biologics allograft that is being used to save or heal a life. So going back to Extearna. So what is Extearna? So Extearna is costal cartilage from ribs 5 through 8. And costal cartilage is found on our ribs. You can see here, this is the rib cage in the green. We've highlighted the costal cartilage. So we take the cartilage from ribs 5 through 8. We only provide it on donors aged 12 to 20 because we want that cartilage to be very malleable, very shapeable, easy to bend and suture into an ear construct. So that is what Extearna is. And Extearna is used primarily for people who have microtia. So microtia really just means small or underdeveloped ear. And it's very common in people who may have Treacher-Collins, hemifacial microsomia, Goldenhar syndrome, or due to trauma. And it comes in different, stages. So it can be, less severe to more severe where they actually have no external ear. When you want to reconstruct the ear, the parts of the ear, that we want to reconstruct are the helix or the ear rim, the antihelix, the tragus, and the antitragus. Because when we see an external ear, those are the parts that, your mind kind of puts together and says, hey, this is an ear. Now, currently, the reconstruction options that are available are using autologous costal cartilage. So autologous means self. So that means we're using cartilage from the patient, him or herself. That is right now the gold standard. That's where probably 80% of reconstructions are being done using autologous costal cartilage. The upside is that there's less chance of infection than if you would use a synthetic graft. Anytime you put a foreign object, that isn't as biocompatible, isn't human into the body can kind of see it as a foreign object because it is, and there's a higher chance of infection. The advantages are that you can perform, the disadvantages are that you have to wait until the child is old enough to be able to perform the reconstruction because they have to be large enough, their cartilage has to be large enough to support the reconstruction. There is a risk of chest wall deformity, as you can see in this photo over here on the right. Sorry about that. You're going to have pain and scarring at the site of the rib harvest. So where they took the cartilage from the rib, as you can see again in that picture, there can be some long-term deformity and of course scarring, pain, a longer hospital stay. Usually a child is kept in the hospital 2 to 4 nights for this type of procedure, and a longer recovery because again, you have 2 surgical sites that have to heal versus 1 if you weren't taking the rib to make the ear. The other option that's currently out there, used maybe in 20% of ear reconstructions, is using a MedPore, which is kind of like a plastic resin synthetic graft. Now, the advantage with this is that you can perform the recon earlier because you're not waiting for the child to be a certain age and to have large enough cartilages. Downside, again, as I mentioned, because it's not a natural material, there is a higher risk of complication like infection, extrusion, which you can kind of see in the photo down here in the lower right, where the body, again, it sees it as a foreign object and wants to kind of expel it, and it starts to extrude through the skin. It just may not take. So implant failure and fracture. So, the child's playing baseball and he gets hit in the ear with the ball, it could fracture and then you have to do a revision surgery. So there are, positives and negatives to both options.
Yeah, I do have one question
Sure.
on the MedPore. Would you still also need a skin graft if you were having the synthetic put in? Do you still need skin over that?
I think it'll be covered by skin. I don't know if they have to do a skin graft or if they can use the child's own, the flap of skin like they do with the autologous.
Gotcha.
I'm actually not sure. That's a good question. So with Extearna, we feel that we've kind of combined the best of both worlds. So you have the advantage of, it's biocompatible. It's not the child's own cartilage, but it is human cartilage. So there is that lower chance of infection, extrusion, and fracture. You can perform the recon at an earlier age because you're not waiting for the child to be large enough. They're not going to have that secondary surgery site. So there's not the pain, scarring, chest wall deformity that can be associated with that. It's a shorter procedure, shorter operative time. I've heard several surgeons say, it's like 45 minutes versus 2 hours, 3 hours, a shorter hospital stay because again, they're not having to, watch both sites and make sure that, you're okay. It's less traumatic, and a shorter recovery time. The disadvantage is that this is a new option. So, many surgeons and patients don't know about it. They're just learning about it. So we really appreciate the opportunity to be here today and share information about it. So whether the surgeon would use autologous costal cartilage or our allograft costal cartilage, the procedure for creating the ear is pretty similar. The same. So they usually start by making a template from the child's existing ear. A lot of times microtia is unilateral, meaning it just affects one ear and they have the other, normal ear. So they will kind of trace that ear so they get an idea of size, shape. They'll take measurements as to where it's positioned on the head. And then they will actually carve, using that template, those major parts of the ear that we talked about earlier. Suture them together, and they will have this ear construct. The reconstruction is usually staged. So the first stage, if they're not using Extearna and they're using, autologous cartilage, they will harvest that cartilage from the child. They will carve it, sculpt it into that main ear framework that we just saw, and then they will insert it in a skin pocket on the side of the scalp that's affected. So this is the end of stage one, and this child will go home. They'll allow that to heal and bring him back a couple months later to do the second stage, where they form the earlobe. Sometimes they can use, the child's own ear. So this a lot of times is what they were born with. It looks like a lobe. So sometimes they can incorporate that and make it the earlobe of this new ear. They will deepen the conchal base, and then in the final step, they will elevate the ear from the scalp, and they use a little wedge of cartilage. So in the first stage, there's always leftover cartilage. They will actually bank that in that same skin flap, under in the scalp while it's healing, and then when they go back, they'll take out that cartilage and they'll make these little wedges so that the ear is not flush against the scalp. You want it to have a natural projection. So that is kind of the way that it works. To date, we've had more than 85 units distributed of Extearna. There's about a dozen surgeons using it. It seems to be in California, Texas, New York, Ohio. So we're really excited. The first procedure was done in June of 2020. So we are 3 years out. There is a few abstracts written by the doctor who has done the most cases, and the first, that's Dr. Bastidas in New York. And we're hoping to get, some published data, which will go, a long way in making surgeons and patients feel more confident that this is a safe, effective alternative to the other two options currently out there. We do have a story that was picked up by local media in the tri-state area. Luca was a 5-year-old and he had ear reconstruction using Extearna. You can see this is after the first step. This is the ear that he would have been born with. So they reconstructed this ear, and then they'll probably use this to make his lobe or, remove any of that excess there. But there was a press conference, and he is a big fan of Iron Man. So he got to meet Iron Man. Along with his family, he was presented with an Iron Man figure. And if you want to read the story, just scan on the QR code there, and you can read all about Luca. And then finally, if you'd like to learn more about Extearna and our other allografts for other craniofacial procedures, you can scan this QR code and it'll take you to our brand new craniofacial landing page. Thank you.
Yes, thank you so much. It's so fascinating to me. I really enjoy learning about the procedures. And I think this is especially going to be helpful for some of the parents who maybe have just had a baby and they're looking forward a couple of years as this gets into more hospitals and more doctors start using it. You should definitely ask your team, even if your little one is still very young and you're not at that surgical stage yet, you can always ask your craniofacial team. They may not have heard about it. They may just be being introduced to it, but when the time that they're ready for surgery, it might be, the option for you. So I thought it was really exciting to me to present this because we have people on all, ranges of the spectrum. And there are also adults who haven't yet had reconstructive surgery, and maybe as an adult they're looking into doing that. Lisa, do you know if they would be candidates for like coming back into?
Absolutely. We've had some adults, and especially with trauma too, like, with ear dog bites and such, but even, congenital differences that weren't corrected earlier. Sure, adults are also candidates for sure.
Well, that is very, very cool. Because like I said, I was just going on, we have the range of ages in our community. And so we like to present new and emerging opportunities for you guys in your reconstructive and craniofacial journeys. So I think this is a really exciting one. And I very, very much appreciate Lisa and MTF Biologics for sharing it with us.
Thank you. Very happy to be here and share this information about Extearna. Thank you.
You're welcome. We will link to these QR codes also in the bottom. So if you see these and you're watching online, the links will be below in the YouTube description. All right. Thank you, everyone.